In UK, 21 women die from cervical cancer every week. It is the most common form of cancer in Europe among women aged between 15 to 44. But the good news is, it can be avoided. Cervical cancer is the most curable cancer of all, and UK is fortunate to have cervical screenings. But the sad part is, only fewer women are attending their screenings. However, we saw a sharp rise in the number of women attending the screenings last year. According to the Joe Cervical Cancer Trust in UK, there was an increase by 12% for the first time in many years. This increase was attributed to Jade Goody for fighting her battle against cervical cancer publicly, which led to a lot of awareness among women. But this year, the numbers seem to be coming down dramatically. What could be the reasons behind this? Well, let's ask the experts.
At the time that Jade Goody was diagnosed with her cancer and around the time that she died, there was quite extraordinary publicity, and for the first time in probably I think 10 or 12 years we saw this increase in women going for screening, because perhaps before then it was very much a forgotten cancer, and so there was a real concern. But sadly the numbers do seem to be going down. Why, we're not quite sure. I think that's something we've got to look into. We've got to really try to understand the motivations behind women in regards to why they don't go for screening. You know, is it the process itself? Joe Cervical Cancer Trust has done quite a lot, I think, post Jade Goody, because it highlighted the real need for very targeted education awareness programs. So, for example, one of the things that we did was we targeted in particular younger women, where the screening uptake is even worse. About 1 in 3 women don't go for screening, so it's a real worry.
There's a need for awareness now more than ever. Women need to be educated about the screenings, because surprisingly it is the screenings that most of the women are scared of.
With cervical screening, the very nature of the test, it's quite an invasive test, and I think that generally it's perceived that it's not nice. You know, you obviously feel that you have to get undressed to do the test, so there's a lot of barriers really for women to actually come and have the test in the first place. So it's a little bit different than some of the other screening where you don't have to, in effect, take time out of your day, go to your GP, actually undress to have the test.
Cervical cancer screening starts at the age of 25 to 65, but there are calls for increased screening of younger women. But according to the Health Minister Anne Keane, it is important to prevent cervical cancer cases, but screening under age 25 is not the solution. We'll find out why.
In the UK, the screening ages are from your early 20s until your early 60s, and some people have called for the screening age to be lowered, but the ages of screening are determined by the screening committees, and they're based on evidence of the age groups that are most at risk for cervical cancer. And for women who are under 25, their cervix, they quite often have changes in their cervix, cells that will change, that will resolve on their own without going on to cause damage. So it's perhaps not as it's not a good idea to treat these changes in these younger women, because they won't always go on to develop cancer. So the evidence suggests that the groups most at risk are those from their early 20s up to their early 60s.
About a year ago there was this big national campaign and discussion about whether the age for cervical screening in England should be reduced from 25 to 20, because it's 20 in Scotland, Wales and Northern Ireland. The decision was made to keep it at 25, but at the same time the committee that took this decision realised, I think having spoken to a number of young women who were diagnosed with cervical cancer under age 25, that more needs to be done to recognise symptoms in younger women. And so what they've done is they produced these guidelines for GPs to be more aware of symptoms and to, I suppose, to fast track any women that there may be some concerns that they may have cervical cancer, so that even if, unfortunately, those women do have cervical cancer, that cancer is caught much earlier, and therefore hopefully the treatment options will be less invasive, and the survivorship will be higher as well. Because the earlier that you catch this cancer, the survival rates are very high. So, for example, stage 1 cancer, survival rates after 5 years are between 95 and 98%.
The new guidance was produced after working with a group of advisory committee on cervical cancer. These new guidance hopes to improve the cervical cancer diagnosis in younger women.